Now, the joy of every parent or couple when they get pregnant is to have an uneventful pregnancy right up till term. And term means from 37 weeks of pregnancy up to 42 weeks of pregnancy. That is the window of term. Unfortunately, that does not always happen for some reasons, which we are going to be looking into today. Babies do come early. Sometimes parents or couples know ahead of time that their babies will come early for some of the reasons we are going to be looking at today. Other times it comes as a surprise and a shock. And in this video, we are going to be looking at the top reasons why preterm births happen in the first place. So I encourage you to sit tight, get a nice drink, and follow me right through to the end as we look into those top reasons. Welcome aboard Julie City. As usual, I'm so excited to be here and I'm glad you are here. If you're seeing me for the first time, my name is Juliet Etuma, a registered nurse and midwife practicing in the UK at the moment. Our residency requirement here, that red subscribe button, click on it. And the notification icon, that way you get notifications for all my uploads as soon as they come. And for my returning subscribers, thank you so much. I appreciate your trust in me. And in today's video, we are going to be discussing the reasons for premature birth. The first reason for preterm birth is unknown reasons. I know that's shocking, isn't it? Yeah, but up to 40%, as research says, of preterm birth happen for unknown reasons at all. There's still a lot of work and research going out there to determine more why preterm births happen in the first place. The number two reason is your previous pregnancy history. If you've had a previous history of having a preterm birth, then there's that likelihood that it might repeat itself. So there's that likelihood that you might have another baby too soon. Also, you were involved in a car accident during this pregnancy, or you fell and hit your tummy or your waist on the floor during the pregnancy, or any form of trauma on your cervix, the chances are higher for preterm delivery in this situation. Also, you had a previous history of bleeding during pregnancy, the chances also is higher to have this baby early. It's always advisable in any of these cases to seek advice from your midwife or your doctor, as the case may be, in order for you to get relevant advice and relevant medical intervention to ensure that this pregnancy goes smooth. And even if you have to have your baby early, you have all that you require to make it safe. The third point is infection. Infections can happen within the womb or in the genital tract. Either of these makes a pregnant woman stand a higher chance of having a preterm birth. Some of these genital tract infection could be gonorrhea, could be syphilis, could be chlamydia, HIV, or even urinary tract infection. If any of these infection, when they occur, is not adequately treated by the relevant professional, it might actually result in preterm birth. The number 4 cause of preterm labor is what we refer to as preeclampsia and or high blood pressure. We know that the baby in the womb depends on its placenta to survive, and the placenta depends on the maternal or mother's blood to gain its nutrient, so it connects to the blood vessel. However, with increased blood pressure or even preeclampsia, things actually would go wrong if not well managed. From 20 weeks, high blood pressure can begin to manifest itself, and that is why, if you notice, when you're pregnant, your midwife checks your blood pressure and checks your urine, and that is all geared towards monitoring your blood pressure and monitoring for any signs of possible complications that could lead to preeclampsia or even more serious condition like eclampsia. I wouldn't want to bore you with all the terminologies, but just to know that this is not good for the developing baby in the womb. it can actually be deadly if not properly managed, both for the mother and for the baby. And one of the things that might happen, or one of the line of treatment, might be actually getting the baby out early or earlier, so resulting in preterm birth. Another reason for preterm birth is in what we call intrauterine growth restriction. So when baby is too small for the gestation, baby is too small for the time of the month. That is why you have the tummy measured, you have the weighing, and you even have scan to ensure that baby is growing accordingly. However, if during these checks it is found that the baby is not growing as it should, there will be plan to get this baby out of the womb in order for the baby to survive, so leading to preterm birth. If you previously had type 1 or type 2 diabetes before pregnancy, during pregnancy, because of all the changes that happen, the hormonal changes that happen in the body, the possibility is there that what was working for you previously might not be working for you again. There are other people who do not have diabetes at all, but during pregnancy develop diabetes. That is what is known as gestational diabetes. In either case, diabetes or gestational diabetes could actually result in preterm birth. Because of the level of, let me use the word sugar or glucose in the bloodstream, baby is absorbing so much, baby might actually be overgrowing, so growing too big. At some point, the body might not be able to tolerate this and triggers contraction, leading to early birth. Other times, if the diabetes is unable to be managed properly by the medical team, the next best thing will be to get this baby out early in order to be able to treat mommy and treat baby safely. So if you're pregnant and the water that surrounds the baby breaks too soon, there is the possibility of having preterm birth. It's also advisable in this case to seek medical help as soon as you notice that your water has gone. That way, the medical team will be able to put some plan in place to ensure that you stay safe. It might not result to a preterm birth. Sometimes the medical team are able to manage it. However, in some cases, it might be that the baby will need to be delivered to prevent infection for the mother and infection for the baby. Another reason for preterm birth to happen is if the womb is abnormally formed. So it is not the usual shape that carries baby. It does not give baby room enough to grow. So what the body does automatically when there is no more room is the body triggers labor and baby is born preterm. Following that point, if the cervix or the neck of the womb is abnormally formed, again, it is not what the woman has done. Some people come that way. Other times, it could be as a result of infection. If the neck of the womb, or what we call the cervix, begins to open, say from 16 weeks, it begins to shorten and open, which is what it should do during labor at full term, but it begins to do it early, that could actually result in early birth or preterm birth. Is if there's a problem with the placenta. So remember we talked earlier about the placenta. The placenta is the lifeline of the baby while the baby is in the womb. So what connects the baby to the placenta is what we call the umbilical cord. And through that umbilical cord, baby gets all the nutrients they need, oxygen, and it helps baby to dispose their waste products. Now, if this lifeline, the placenta, becomes faulty, it could be as a result of the positioning of the placenta. Or number 3, it could be an abruption, which means maybe a tear or a detaching of the placenta from the wall of the womb could actually be a reason why baby is born preterm. One of the signs that you might notice if you have a placenta abruption will be bleeding, it could be pain, or even contraction, proper contraction itself. Either way, if you notice anything that is unusual, it's important again to contact your midwife It is an emergency that needs to be attended to ASAP. No wasting of time, please. So lifestyle is the final point that we're going to be looking at that could cause preterm birth to happen. So when I mean lifestyle, I'm talking about things like the weight, being too overweight or being too underweight from age 35 and above, and also approaching 40 and 40 and above actually is looked upon as a higher risk for any pregnancy complications, including preterm birth. So mothers who have higher maternal age are monitored closely by their medical professionals to ensure that they get adequate treatment and management to prevent or support any form of complications that might occur during their pregnancy. Another lifestyle point, we've talked about the weight, we've talked about the maternal age. If you are a big user of alcohol, the possibility of preterm birth is higher. Recreational drugs, yes, or even prescribed drug that you're taking overdose, all of that are all possible causes of preterm birth. Those who do not follow their antenatal appointments correctly are at a higher chance of having preterm baby. So if you miss a lot of your appointments, some of these complications that we've discussed previously might not be identified on time or quick enough for proper intervention, which will result in preterm birth. I'm going to stop here for today. I don't want the video to be too long, although there are other points, but these are the top factors that has been identified as the main reasons for preterm birth. Remember, mom, most of these are not your fault in any way. Just look after yourself, and the advice will be, if you notice anything that is abnormal or unusual during your pregnancy, please don't hesitate to contact your midwife or your doctor so that you will get the relevant treatment that you need to help manage the situation. And if it ends up that you have a preterm baby, then at least you would have done your best, and baby will be supported adequately on the neonatal unit to ensure that you are safe and your baby is safe. So till I see you next time, if you have not subscribed, please do well to subscribe. Give me a thumbs up. Check out my videos, these videos. Yes, come to work with me. Yeah, I take you through my neonatal routine and all my other interesting videos following these links. Remember to give me a thumbs up, share. Until I see you next time, stay safe, stay alert. Bye-bye.